My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the Expect Miracles podcast, we have Courtney Maiorino. Courtney was diagnosed with a severe case of Crohn's disease back in 2012. At first, Courtney went the standard Western medicine route, which involved many pills, drugs, and was even given the option to have major surgery to treat her condition. After many dead ends, having no hope, and not knowing what to do, Courtney took matters into her own hands and developed an intuitive autoimmune guide, which helped her heal from a very severe diagnosis and get her life back. Courtney is now fully medication-free thanks to a ton of diet, lifestyle, and deep mental and emotional mindset changes that she has kept up with over the years. She has an amazing story, and I'm excited to share it with you today. Please welcome Courtney. Today on the Expect Miracles podcast, we have Courtney Maiorino. Courtney, how you doing today?
I'm great. How are you?
Very good. Courtney, you have an amazing life story that I'm very excited to jump into, mainly because you were able to heal yourself from a autoimmune disease. And there are so many people out there suffering with that just don't know what to do. So I'm very excited to see what avenues you went down, what worked for you, what didn't, and what you're up to today. So Courtney, where are you from originally?
So I'm originally from Portland, Maine, born and raised.
So, and what were you into growing up?
I was into sports. I wasn't like super jock, but I played 2 sports in high school. Pretty active person. Nice.
And so when did your health crisis kind of start? Was it at an early age? Was it after high school?
So I had some surgeries kind of as a young adult, just kind of like normal things that people go through. And then from about, I would say middle school, high school, I was pretty like healthy, like an average person. And then in college around 2009, I started having symptoms of like digestive, and then we kind of blew it off. So I was like not worrying about it. I was healthy. There was nothing wrong. It was just stress. And we didn't really think much of it because I was healthy. And so it continued to persist. It continued to happen. And we got to a point like 2 or 3 years later where it got so serious that we couldn't really ignore it anymore. And so we did like food sensitivity testing, celiac testing, all of the like normal first testing that kind of doctors would go through in terms of diagnosing somebody with something.
You went to your primary care physician first and foremost, and then so they said, let's do some testing, see what's going on.
Yeah. So I didn't have a reason to see a specialist at that point. My primary person for medicine was my PCP. So I went to my PCP and they did all kinds of food sensitivity, allergy stuff, and nothing came back with any answers.
Wow.
And then...
So it all came back clear and you were just not feeling good at all?
Nope. All of it came back clear.
Okay.
So we continued to persist because I wasn't feeling well. And the last ditch effort after like years of testing and kind of just waiting things out and seeing if it would go away was a colonoscopy. And I was diagnosed at age 21 in 2012 with moderate to severe Crohn's.
Wow. And so what's that like, getting a diagnosis like that? The doctor says you have an autoimmune disease. Like, what's the first thought that pops into your head there?
I still remember that scenario, waking up from the test. My mom was there. The GI doctor was there. And he told my mom what I had because I was kind of sedated still. So he wasn't really talking to me. And I remember, I don't know if it was the weaning off of this, like the sedation or just the gravity of the situation. I think it was both. I definitely started crying and I was very emotional, very angry for a long time at having a solid diagnosis that literally changes lives.
And so how worried were you at this point? Because you were a relatively healthy person and then your health just started going. Did you you must have been really worried and you didn't have a reason why. You didn't know. That's what's
No.
probably the scariest part. Yeah.
Yeah, no reason, no prior. At that point, I had no idea that anybody in my family had autoimmune disease. We had no knowledge of that because nobody was talking about it. And then I officially got diagnosed, and we found out that a few other people in my family have various autoimmune disease. So it does kind of run in our circle. Yeah. It was very tough at first. I was very angry and very hard to be around because I think the first emotion and the first thing that people go through when they get diagnosed is kind of the anger portion of things. And it can last a very long time depending on how self-aware and how willing people are to process it and move through it and work through that. But anger was definitely where I was at for a long time.
Now, what did they tell you? So they said you have moderate to severe Crohn's disease. Did they tell you that it's curable? Did they say, we don't know what's going to happen?
So definitely not curable. They told me that I would be on meds forever. They told me that I was not going to be able to eat any fruits and vegetables ever again. The language that they use, honestly, it's unfortunate because I don't think they think about how what they're saying is going to be imprinted into new patients' heads and how we're going to take
very powerful.
Yeah, we're going to take that as kind of gospel, as what is. And so that's what I was told. I was going to be on meds. I wasn't going to be able to eat healthy food. And I think the underlying tone of all of it was that my life was going to suck.
Mm-hmm.
And it can at times. I mean, it does at times, but it's also that's not the case anymore. So I think that definitely having that be the first thing out of the gate that I heard was really hard.
So what is Crohn's for everybody that's never heard of it?
So Crohn's disease is an inflammatory bowel disease. It affects the digestive tract. So from your mouth all the way through your digestive tract. Some common symptoms are abdominal pain, bloating, distension, frequency and urgency to go to the bathroom. Sometimes if you're very inflamed, it can lead to kind of more intense symptoms like surgeries and things wrong with bowel movements and things like that. But a lot of it is pain, swelling, and then the typical symptom is very frequent, urgent need to be in the bathroom.
And that must be the most difficult thing ever because you don't know when it's going to happen and you kind of have to base your life around that, right?
Yeah. So when I was newly diagnosed, I developed a habit of always knowing where a bathroom was. So if I was at work, if I was at the mall or at the movies or in an airport, I always kind of had to know where that was. And I think that that's typical for a lot of patients, is needing to have that safety of knowing, at least if something happens, where do I go?
Mm-hmm. So what was the first plan of action here? You just got the diagnosis. The doctor says, we are going to do this. What did they do?
Medication. So got diagnosed. I think that same day I left with a script. It was steroids and immunosuppressants. And at that point in 2012, I had no knowledge of wellness, no knowledge of nutrition, anything like that, or the importance of it. So I did what they said. I did what I thought was best. I did what I thought my only option was. And so I took them for a long time.
Yeah, absolutely. And how did it make you feel?
Oh, so bad. So the steroids made me feel crazy, mentally not myself at all, not stable. I had very frequent and interesting mood swings. I was crying a lot.
Mm-hmm.
And then, unfortunately, a very typical side effect of steroids is weight gain, and I gained a lot of weight very quickly.
Mm-hmm. Okay. And so was there a point where you're like, okay, I've been on this for a long time. I'm not seeing any improvement. Did you get to that point?
So while I was going through kind of my new diagnosis, I was in school, in college, studying wellness. So I was supposed to be in a nursing program here at a local college and then wasn't getting grades to make that program. So I had to transfer my credits to graduate on time. And the only major that I could transfer to was a major in wellness. And so coincidentally, I was able to use what I was learning.
Perfectly.
Yeah, honestly, it was not a coincidence at all. It was definitely like a divinely guided scenario. But I used a lot of the things that I was learning on myself and I was learning a lot about nutrition, lifestyle management. I was in a Reiki class for my minor in college. And so I was kind of at the point where I was learning all of these things and applying them. And I was never one to take medications when I was younger. So I always had that foundation of not being someone who did that.
But you were told this is how you're going to fix it. So yeah, you believe it.
Yeah. So with that foundation and with my studies, I just decided to start shifting things that I could control that weren't meds and see if that would help in order to get me to a point where I wouldn't need them anymore.
So what were you coming across at this point when you first started doing some research into like natural remedies and alternative medicine? What was coming up?
So the first thing that I kind of fell into was changing my diet. So that's pretty much the first thing that everybody kind of stumbles upon when they enter wellness and health and alternative medicine. And so I was playing around with that. I switched so many things, but I finally landed being gluten-free and plant-based. And that seems to work, at least for me personally, in terms of allowing me to eat healthy and feel good, but also get the inflammation down to a point where I no longer need Western medical intervention, at least at this point. So that's a plus. Yeah. And then after that, I really got that solidified. And then I realized how my mindset really sucked.
Well, that must have been a process, just getting that alone, right? Like that probably didn't happen overnight. How long do you think it took you to figure out what works, what doesn't? And I bet you that took a while, right?
I think it took at least a couple of years.
Mm-hmm.
And I'm always kind of playing around with my own life and my own treatment protocol because
Absolutely.
Stuff is changing so much. I mean, there's new things coming through all the time in terms of what's benefiting people and what could potentially be working for others and things like that. So yeah, it definitely, none of this happened overnight. And I think that's the great part of it, the amazing part, because it requires work and determination and discipline. But I think that's also the hard part for people who are new to this, is because that's hard. We want a quick fix. We don't feel good. We want this to be better now.
Yeah. Everybody wants that magic pill, but I feel like true healing definitely takes place over time.
Definitely.
So at what point did you say, I'm done with the steroids?
So I was on a steroid and an immunosuppressant drug from 2012 until I think mid 2013. And then I made a large decision that was not a smart one, but I made a large decision to wean myself off my first steroid by myself. And so I was so frustrated, like you said, I was so done with it, so frustrated where I didn't want the side effects anymore and no one was listening to me. So I just did it. And obviously I don't recommend that. It's not a great idea.
Yeah.
But what it taught me is that like I can make my own decisions and there are consequences either way, positive or negative, but I do have the power to make my own decisions. And so that was my first taste of going med free, at least for a little bit, like minus the steroid, and seeing like, oh, I can make that decision and see what happens and then go from there. And I had to deal with not great things after that because of the decision that I made, but I also realized that I can make decisions like that and then see what happens.
Absolutely. It's a lot of trial and error.
Yep.
And so you just kind of touched on something that I find extremely important to the healing process, mindset.
Yep.
So what was your mindset like throughout this whole entire process? And like, when did it start to shift for you?
Yeah. So when I first got diagnosed, I was angry. I don't know I think a few of your listeners, I'm sure, in your community have chronic illnesses or know what the community is about. But unfortunately, within the mainstream chronic illness community, the underlying tone is anger and resentment and hatred of your body, of what's happening to you, of your illness. And when you get diagnosed, you kind of adopt that.
Mm-hmm.
And that's what I did. Yeah. That's what I did. I mean, you want to fit in, you need a community, so you adopt whatever mindset everyone else has because you think that that's normal. And I did it for a long time, and I didn't know the correlation between mindset and healing and the benefits of seeing differently and thinking differently. And then I was at a wellness retreat in 2014 out in California for Crohn's patients, and I met a clinical nutritionist. Her name is Jessica Flanagan, and she did a lot of work with autoimmune patients in terms of eating style, but she was also diving into some new information about loving, and how love is medicine, and loving your illness and learning from it, and how mindset and the way you see things is so important in terms of being a patient. And so I read her book called The Loving Diet, and obviously it wasn't a light switch in terms of changing my entire life, but it was the spark that was a catalyst for a mindset shift for me that literally changed my life. Once I read and kind of adopted that into my own life and in my own way, I was able to see Crohn's as a blessing and see the lessons that it was kind of bringing into my life, and was able to navigate the highs and the lows that it has with more ease and more grace. And it was a way better way for me personally to see this experience because it's not going anywhere.
Right. Absolutely. And so, yeah, mindset is very huge and very important. So is action as well. So I remember I didn't have autoimmune disorder, but I had like a traumatic brain injury. So I got lumped into the TBI category and talking to all these people. And it's a very sad community because these people think they have no outlet and you fall into that. And so people are like, you got to be positive, have a positive mindset. So every night I would go to bed, tomorrow's going to be different. I'm praying for a better day. And I was doing that. And nothing was changing. Like nothing was changing. And it also does take massive action. You have to implement what you're learning to, fix the problem, like as you were saying. But anyway, okay, so you shifting the mindset a little bit. And what was next for you?
So after mindset, and once the food was solidified, I realized that honestly, I had a bump in the road. So my mindset was somewhat shifted. It wasn't 100% there. My food was, I would say, about 90% there, but I obviously was still like doing what I wanted the other 10%, kind of shrugging it off, not being as disciplined as I wanted to be in terms of reaching the goal that I had.
Mm-hmm.
So,
which was what? Obviously being symptom-free?
Symptom-free, med-free, Western medicine intervention-free, all of that stuff.
And what was the speed bump that you hit?
So I was learning about wellness, applying all this stuff, had just begun a training program for health coaches, was learning more wellness things, and I was applying everything that I was learning. And I assumed somewhat naively, probably, that all that stuff would be enough to save me. And while it is, to a degree, an autoimmune disease diagnosis and disorder and things like that is not without hills and valleys. It's just the way that it's going to be. So I found out that after a checkup with my GI doctor that my inflammation levels were really high. And I had two choices. So he looked at me and he was like, you can either have surgery or you can go on a biologic infusion medication called Remicade, which is essentially like an IV. So I would go into the office every 8 weeks for an IV for 2 or 3 hours, let it drip, and then leave. Once every 8 weeks for a couple hours? Okay, question for you. What did they tell you? What's the success rate of the surgery? So I think my intestine, I don't exactly remember the specifics of the situation at that point, but I think my intestines were so inflamed that they wanted to take out the portion of my intestines that was inflamed and go from there. And so unfortunately, in the Western medicine system, that's a pretty common procedure for people who have autoimmune disease, just taking out disease portions and going from there. And unfortunately, I had known about Remicade already, and I had a pretty not positive connotation to using that medication. But in my head, it was better than having an abdominal surgery. So I chose to take Remicade for a while. I mean, unfortunately, when I made that decision, my physician and my nurses were under the impression that I was going to be there forever because that's the normal route that people take. They're on this med for the rest of their life, and that's their treatment. So with Remicade, normal side effects of medications like nausea, vomiting, like I think those normal ones, no. I didn't have anything in terms of side effects. There's a very somewhat small percentage of obviously cancers and things like that. However, because I had already researched Remicade and I already heard about it and heard the horror stories in terms of my perspective of it, the small percentage of cancer potential was enough for me to know that I didn't want to do this forever. So I had already had it in my head when I started that I wouldn't be doing it forever. Yeah. So how long did you do it for? I was on the medication for 2 years. Okay. And so what made you stop? So within that time period that I was on Remicade, I was still also on the oral immunosuppressant drug at the same time. And I was working on solidifying my eating style, making sure that was as healing and alkaline as I could possibly have it. Probably a little more than I should have in terms of keeping me sane, but I did it for a potential goal. And then I worked heavily, a lot on my mindset, making sure I was coming from a loving perspective, understanding what this was teaching me and what the lesson is here and all these things, and really making sure that my stress levels were low and making sure I was taking care of myself in a really holistic way. And I was on it for 2 years, and I had a checkup, so another scope and some blood work, and the results came back really well. The lab work was low inflammation, and the scope came back with no issues. And so at that point, I made a really hard decision that was personal to no longer take it anymore.
Good for you. And so what happened after that?
So after that, I went back and forth. I made the decision, was so confident in it. And then after, obviously, you make a large decision like that, you're like, oh my God, did I make the right decision? Did I do what's best? I'm like, did I screw up? Like, whatever. But as time went on, I'm definitely more confident in the fact that I made the right decision. I was still on the immunosuppressant drug still after that. So after I ended Remicade, I was on the other drug for another year and a half, I think. It was a year in October. So October 2017. I was having some other weird symptoms that weren't Crohn's like typical. So I was obviously nervous. So I called my doctor and shared with them what was going on with me. And we came in and chatted and did some blood work and figured out that my liver levels were high. So they were nervous that it was something else that was wrong, that I had another issue on top of Crohn's, that this was something else that we'd have to deal with. So to make sure that that wasn't the case, we did a lot of blood work, imaging, all these things to make sure that nothing was wrong with my liver. There was nothing else going on. And when all of that came back negative and everything was clean, my nurse practitioner that I was seeing at the time, she was like, well, you've been on this drug since 2012. It's now 2017. Maybe you're just done. Like, maybe you just can't take it anymore. So we did some more blood work to find out if the medication was affecting my liver. And we found out that the medication that I was taking gave me a drug-induced liver injury.
Oh, man.
Yeah. So that was interesting.
Yeah. So you have this liver injury now from the medication. Yep. So what's going through your mind and how are you going to fix this one?
So I was honestly really nervous, especially considering I'm not someone who drinks a lot of alcohol. Like, I don't do things that would compromise my liver. So to have that happen to me because of something that I was taking as a precaution for something else that was going on with me, I was kind of frustrated. But when I found out that it was the medication, I knew in my head that I didn't want to take it anymore, obviously. But the nurse who I was talking to wanted to try me on a different med. Yeah. So she was like, well, this one doesn't work, but let's try you on something different. Mm-hmm. And I looked at her and I was like, no.
No.
Like, I'm not.
I'm good.
No. Exactly. Yeah. So if that medication is doing something to my liver, what's to say that whatever else you put me on is not going to make things worse, right?
Absolutely, yeah. Good for you for realizing that, because that's another professional saying, let's try something else, another medication. They have the best intention for you. They want to get you better, but that's what's in their tool belt. That's how they do it. So
right. Yeah. And that's one of the hardest parts is like, they're well-intentioned, they mean well, they're kind, they're educated, they just want to help. That's why they're there.
Absolutely.
But unfortunately, their toolbox is so one-sided that what they now know is no longer benefiting people who have a chronic illness.
Yeah. You kind of just touched on it. My problem with that is you just found out that this person has a liver injury. You want to put them on another medicine that probably has other side effects. At what point do you put yourself in check and be like, this isn't working. Why don't you try something else? Maybe natural. I mean, and there are the practitioners that do that, but there's also I was told to never, ever, whatever I do, never go see a chiropractor. After I was doing with all my head injuries, they'll mess you up. And I'm like, and I listened to them for like a couple of years. And then after that, they wanted to put me on more medication. I was like, no, I'm good. I went to my family chiropractor and I'm so glad I did because it put me on the path I'm on now. But like, it's amazing how often you mentioned this before, you do have to trust that intuition and your gut instinct because there's something that's pulling you in a different direction. And, sometimes it leads you down a road you don't want to go down, but more times than not, it's going to pull you in that right direction. You really got to listen to how you feel about it.
Right. And that's the hardest thing too, I think, especially I know, with the TBI and with me with being in the Western medical system too, is like, we're not taught to listen to ourselves. We're taught to listen to other people. And that's really hard because like we just said, they're well-intentioned. They know what they're talking about. They have knowledge in that area, but unfortunately they don't know our bodies best. We know our bodies best.
Right.
So to go in a different direction, and I'm sure you experience this too.
Yeah.
To go in a different direction after someone who is well-educated is telling you no, like, it's really
and the look on their faces when you tell them you're doing that, they admit you're like, oh man, did I make that right decision or not? Because they just look like you have like 6 heads. You're like, okay, fine, try it. It's like, okay.
Exactly. But it's worth it.
100%. Yeah. So you didn't want to go on that medication. You're starting to develop all this knowledge of kind of how to take care of yourself at this point. So what was your next step there?
So I was finally medication-free October 2017 after being on meds since 2012.
That is beautiful.
And I really dove into, it was scary and amazing at the same time to finally reach the goal that I've been working towards. In terms of my liver, honestly, I would love to say that I put a lot of emphasis on focusing on that. Unfortunately, I didn't, and I probably should have put more on it. I was just so excited to finally have the freedom that I had wanted for so long. I still took care of myself the way that I was in the past with eating and things like that, but I wasn't going hardcore in terms of like a liver detoxification or anything like that. But I haven't had any issues since then. So after that, and the food and all that stuff, I was solidified. I was diving more into energy medicine. So that's kind of where I'm sitting now, is like Reiki and energy medicine, and how stored energy that is kind of stuck is playing a whole role in this. And that's where I'm kind of learning and helping people with now.
That's great. So can you just touch on that a little bit? So stored energy, how do you get rid of that energy? What is that energy coming from? Because I get Reiki done on me. My cousin does it, and I've had another number of people do it on me. I love it. But if you sit down for your first time, you're like, what the hell is going on here? Every time I get a Reiki session, I am so incredibly grateful for everything in my life. And the only thing I did different that day was get Reiki. So you guys are moving around something which is unbelievable. I'm a huge fan of it. But to the average person, it looks different. So can you just explain what's going on there and how you're able to move that energy around to help the human body as a whole get better and heal?
Yeah. So Reiki is a Japanese healing modality. And I got introduced to it in college when I was studying wellness and holistic health as my minor. And so I took it for course credit, honestly, just to graduate. I didn't really know, again, how it would affect my life and how I would use it. But it's essentially a modality that has 7 energy centers right down your spine, and they are blocked or open depending on a lot of different factors. And so what a Reiki practitioner does is when you get a session, at first they assess your chakras and see if they're open or they're closed or how you're doing. They also talk to you about how you're feeling. So while they'll on one hand assess your chakras and see it from that standpoint, they'll also talk to you about how you're feeling, where you're having pain, where you're having discomfort, and try and connect the two and see where work needs to be done. And then essentially a Reiki practitioner gets attuned to Reiki energy. And so I was attuned in college. And because I'm attuned to the energy, I'm able to facilitate the movement of stagnant energy in other people's bodies. And so I will, through a hands-off treatment, facilitate the movement of energy around people's chakras to make sure that it's helping them instead of hurting them and facilitating healing rather than disease.
Mm-hmm. That's great. Beautiful. So what are you up to now? How are you helping this community that really doesn't know what you know now? So how do you get the message out there to help these, would you say millions of people now, or?
Yeah, it's a lot of people.
How do we get this message out there and just tell people what's going on? And there is a way to heal from this, because most of them are told, like you said, when you're getting this diagnosis, you're gearing up for a miserable life because that's what you're told. And it's just not the case.
Right. So the way I'm kind of stepping up is continuing to share my journey and the way I've kind of transitioned over the few years that I've been a patient of what I've used to help myself. I'm also doing some public speaking, some podcast interviews like we are right now, really sharing what I believe to be a gap in the autoimmune community and the chronic illness like protocol, talking about energy medicine and mindset and perspective and how our limiting beliefs of our capabilities for our health hold us back because we're told from day one, like you have no control, your health is not going to get any better, food doesn't matter, all these things. And so really trying to break that mold of what is normal and have people unlearn the normal, dive into their intuition and see what's right for them and go from there.
Absolutely. And so, Courtney, where can people find you online and where's all your information at?
So I'm usually on Instagram. That's usually where I'm at the most.
Great.
I love connecting with people there. You can also find me on Facebook. I'll friend request. It's not a big deal, but definitely reach out if there's a potential for us to work together for sure.
And what's your Instagram handle?
So it's at, I'm going to spell it for you. It's at CMMAIORI.
Beautiful. And Courtney, if there's one piece of advice that you have taken with you through all this journey and this lesson that you would like to give the audience, what would it be? So I know it's a loaded question and it could be anything.
So it's a loaded question, but it's honestly something I've learned semi-recently. So it's to not be afraid to unlearn normal. So we're told so many things as we grow up as normal, healthy people. We're told so many things as chronic illness patients trying to navigate our illnesses. We're told so many things, even in the wellness world, about how to heal. And honestly, unlearning normal in all of those communities and all of those scenarios and really finding out what works for you is going to be the most powerful thing that you can do for yourself.
I love that. That's great. And Courtney, it actually turns out I have a lot of Crohn's disease and IBS patients, and there's a huge correlation with the upper cervical spine and interference around there. And so we have a lot of patients that just get healed, like their IBS and their Crohn's dissipates over time. And there's not many of us on the East Coast, but there is one in Maine. So I will definitely put you in contact with them. And, if you ever want to check it out, even just to network, it's a good opportunity there. So thank you so much for coming on, Courtney. You have an amazing story. And I'm thrilled that you're out there living your life again and helping people do the same. That's great.
Thank you so much for having me. This was awesome.
Absolutely. All right. I'll be in touch. Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.